Good afternoon. My name is Kyle Edwards, and I'm the managing editor of Native News Online. And welcome to our COVID-19 vaccine rollout in Indian Country forum. Native News Online is hosting this live event on COVID-19 in Indian Country because the coronavirus has negatively impacted American Indians and Alaska Natives around the country at disproportionate rates. When contracting COVID-19, American Indians and Alaska Natives are 4 times more likely to become hospitalized and 2 times more likely to die than their non-Hispanic white counterparts. As of February 18th, 2021, the Indian Health Service, IHS, reports nearly 184,000 cases within the IHS tribal and urban Indian healthcare systems. According to the Centers for Disease Control and Prevention, the CDC, American Indian Alaska Native communities have lost at least 500,307 lives to COVID-19. Even though American Indians and Alaska Natives represent only 0.4% of the US population, American Indians and Alaska Natives represent 1.2% of all US deaths related to the virus. Before we introduce our panelists, I'd like to thank the sponsors who have made this event possible. Thanks to, what is happening? Hello?
We hear you.
Oh, my screen almost went blank. I'm sorry. So I'd like to thank our sponsors for this event, the Cherokee Nation. Their generous support helped make today's live stream possible. I also want to mention our silver sponsors, Avante Optics, Field Museum in Chicago. Our bronze sponsors are the Chickasaw Nation, 4 Directions, the Gun Lake Tribe, and the San Manuel Tribe. Now, I'd like to, so before we begin, today's live stream event that we're hosting on COVID-19 in Indian Country, COVID-19 hit the country early last year. And here at Native News Online, we published hundreds of articles relating to the deadly virus. We were fortunate last year to receive funding from the Facebook Journalism Project, which allowed us to bring on several reporters with the focus of reporting from Native communities that have not received a lot of attention since the pandemic started. Today's live stream panelists are Cherokee Nation Deputy Principal Brian Warner, Navajo Nation President Jonathan Nez, Stacy Bolin, President of the National Indian Health Board, and Dr. Melvina McCabe. Thank you all for joining us. And give me one moment. So part 1 topic, our first topic is COVID-19 in Indian Country. And Stacy, I'm gonna come over to you for this one. The Centers of Disease Control and Prevention report that Native Americans are 4 times as likely to be hospitalized and 2 times more likely to die from COVID-19 than their non-Hispanic white counterparts. From the National Indian Health Board's perspective, how bad is the COVID-19 impact on Indian Country?
First of all, Chimigwich, thank you for having me today. On behalf of the National Indian Health Board, I am a citizen of the Sault Ste. Marie Tribe of Chippewa Indians. Thank you very much for having us here. I think that the impact on Indian Country has been very dramatic. I think that the tribes have had to call upon all of the resiliency that we've been able to acquire over the many years of the many struggles that we have all endured. Our people had a disproportionate vulnerabilities to acquiring this disease, and then disproportionate vulnerabilities to having adequate care once acquired. And when you look at the top 3 things that the CDC and all of the public health professionals advised that we need to do to keep ourselves, to enhance prevention and increase our chances of not getting COVID-19. Those were social distancing, staying at least 6 feet apart, wearing a mask, and frequent hand washing. Well, we have disproportionate impacts in terms of poor housing, where multi-generations of people are living in homes together. We did not have access to PPE initially, personal protective equipment, and we have many nations that do not have proper water and sanitation that is easily available so that they can actually participate in all three of the ways that you prevent this disease from hitting us. So there are other things that I hope that we get to talk about, but that's my initial statement. Thank you.
Thank you. So the Brookings Institution recently released a very shocking report, which showed that people dying of COVID-19 in Native communities are much younger compared to white people. The numbers were quite fascinating and astonishing, really. More than 40% of Alaska Native COVID-19 victims were under 65 years old, compared to about 11% of white people who died of COVID-19. In Arizona and New Mexico, for example, the death rates for Native people aged 45 to 54 are similar to those of white persons aged 75 to 84. Stacey, I'll come back to you again. What do you think these numbers say about the overall health of Indigenous communities and perhaps the quality of healthcare that Native people have, receive in their communities?
Well, looking at this from a historical perspective, when one considers that the Indian Health Service has never been funded according to need, a needs-based budget would put that agency at about $35 to $40 billion per year. And we have fought really hard to get it to $6 billion a year. The long-term policies around American Indian, Alaska Native peoples that have made us have the conditions we have in terms of poor housing, poor education, lack of appropriate sanitation, running water, lack of appropriate health care, all things that are part of the trust responsibility of the federal government. You have a perfect storm to create this kind of danger to our people. We have disproportionately carrying preventable diseases like diabetes, obesity, cardiovascular disease, and then diseases like asthma. All of these things are associated with lifestyle, removing access to native foods, for example, or the ways that we traditionally lived our lives. So there is really nowhere else we would have landed in this pandemic than where we landed, because there are hundreds of years of policy that lead us to this conclusion in a circumstance like this. So we have a lot of work to do to turn this around. The things that we've learned because of this disease, they need to not be held close, but to be shared with the world so that change happens for our people. So the trust responsibilities owed to American Indians, Alaska Native people are honored. And when you look at the life expectancy of American Indian and Alaska Native people, and in some places it's as low as 45, when in counties in South Dakota, where the county next door, the life expectancy is 70, then it tracks that we would get the disease at a younger age, because proportionately our life expectancy is lower, and the circumstances that we have to overcome to be healthy are very daunting.
Thank you for that. And I just want to encourage the rest of our panelists, Dr. McCabe, Deputy Principal Chief Warner, President Nez, if at any time you want to chime in on some of these questions that I'm asking to others, please feel free. Dr. McCabe, I'll come over to you. You have 30 years experience teaching at the University of New Mexico School of Medicine and years of experience in research. Since COVID-19 was new to all of us at the beginning of 2020, how did you get up to speed as fast as you did to learn all you could about this deadly virus?
First of all, Melvina McCabe in a Shahin dog Kia Ani by Chin. Put a chitney chair dog Torlini Chanella. I introduced myself with my clan ways. I'm originally from the Yambato area, which is close to Gallup in New Mexico. That's where I was raised. My mother's family is from Mini Farms and my father's family is from the Crown Point area. The expected role of a doctor working at a school of medicine includes 3 areas, and that is clinical care, provide medical education to its trainees, so medical students and residency trainees, and to conduct research. Now that's someone who's on the tenure track. They're responsible for all 3 areas. Now, all 3 of these areas mandate that anyone in schools of medicine learn how to stay current in all areas. So I learned how to stay current. Staying up to date and current on knowledge meant developing an efficient process, also an effective strategy that would allow me to gain information on almost any topic. Now comes the COVID-19 virus. The virus is a new virus. It's a virulent virus, meaning it can cause severe disease, as we know, and it is highly transmissible, meaning it's able to infect others very easily. The newness of the virus, however, meant we had very little information on this particular coronavirus. It's a coronavirus, and there are others out there. This one was called the SARS-CoV-2. That's the name of this particular virus that is causing the current pandemic. The process of gaining information that I learned in my years helped me know where to look for information, how to look, how to identify the most up-to-date information, and also how to identify the leaders in the field of research and to look at their work. But it also taught me how to read articles that were coming out on COVID-19 and how to read them with a critical eye. So all of that I was taught, and I'm using that right now. I use the same strategy that I just described in my quest for COVID-19 information, and use this to present information on two COVID-19 webinars that the McCabe CPE and Consulting Group presented in October and in January. We did 2 webinars on COVID-19. These COVID-19 webinars presented by McCabe CPA and Consulting Group was one way of giving back to our tribal nation communities. We did not charge for these webinars. And we brought in experts. The very first group that we brought in on our webinar was, I did an overview of COVID-19. We did a mental health component with one of the renowned American Indian psychiatrists from Cherokee, by the way, Mr. Warner. So, and he's wonderful. He is known throughout the country for this. We also had a special cardiologist on who talked on cardiology and COVID-19, and we brought in a pediatric infectious disease person who spoke on pediatrics and the COVID-19 impact on our youth and on our little ones. So we brought this all forth, and it was put out there as a free webinar available to anyone. Sean McCabe, the owner of this business, really has a strong belief in giving back to our Native communities, and he puts this into action, and this was one of the ways that he did that.
I'll come over to you, Deputy Principal Chief Warner. This has been a story that's been pretty astonishing to me over the past few months. The Cherokee Nation, as many of you might know, has lost many fluent language speakers to the virus. The loss of Indigenous elders, knowledge keepers, language speakers, as well as culture and language with them has been significant all throughout Indian country. Deputy Chief Warner, what has the Cherokee Nation been doing to protect these vulnerable citizens?
First, I'll say CO and the God, hello everyone, and I want to thank you, Kyle, you and Native News Online, and all the panelists. I really appreciate it, and for everyone being here. But for us, essentially, you know, I think back to when we first started talking about what was happening abroad and coming in, and we started having these high-level meetings. The first thing that came to our mind was, what do we do with our speakers? And because when you look at 385,000 citizens, roughly we have about 2,000 fluent Cherokee first language speakers that grew up speaking this in their homes. It was a part of their way of life. And we were already having problems just because of the regular things that we go through in Indian country with healthcare and all these things. So we were losing our speakers at an astonishing rate. And then here we get a new virus. We get with new ways that the disease attacks our bodies and so forth. So we were able, in March, we sent everyone home that were 65 and older. I remember the day we signed the order and we sent them home. But when we did that, we had been lucky and blessed that we were already working. We had a Language Preservation Act, the Durbin Feeling Language Preservation Act, that basically injected about $16 million into language preservation. And what that did, though, that was already a foundation, a scaffolding of trust that had been built up over years, multiple administrations throughout the Cherokee Nation. So with that trust and that development, we sent out folks like Howard Payton, who is our executive director, and we started talking to our Cherokee elders and our speakers. And so then as things progressed and as we started learning news about the vaccines and what was coming our way, whether it was Pfizer, Moderna, Johnson & Johnson, all of those things that are out there, we started, again, had been very blessed with the joint venture with IHS. So we had a new clinic. We have several clinics that are strategically located in place. So we had some important infrastructure that it was in place. But the most important thing was our mind connected to our heart, and in that connection, what was ringing out was our speakers. What do? We put them first. Simply put, we put our speakers first. We wanted them to be the first in line, but as all of us on here know that element of trust is key to all of our elders and to all of our native tribes across Indian country and everywhere. So we had people that were in place that went out and talked to these folks. We found those strategic members of those little communities in Marble City and Kenwood and places where I call home out there to talk. So, and today, when I look back at when we first got our first allotment of vaccines in mid-December, we vaccinated right around 24,000 people was the last information that I got in. About 1,000 of those are our Cherokee speakers. So we're at 50%. I was hopeful that we would be more, but I think some of the things that have been encouraging is our workforce and some of our elders. They have been willing to step up and to be those spokesmen and spokeswomen of that element of trust. And I think for us, now our next step is it's public health messaging. There was so much misinformation out there early on, and everybody tunes in to their own news stations at home. And it just depends on which angle that was coming from, what you heard. And today we've been able, during you had CARES Act, and we were able to think, how does this affect us, not today, not next year, but 10 to 15 years down the road? Because, obviously behavioral health issues, substance use disorder, all these things have been very much exacerbated by COVID-19. So, and those multi-generational family units that we have out there, one of the first important things we did right next to where we're putting the Durbin Feeling Language Center, that's going to house all of our immersion, all of our master apprentice language programs and our translation departments, our animation departments that work in that area. Right next to that, we had a group of pine trees. We were able to purchase that land, and that's going to be our new speaker village. We've got 5 units in there right now, and we're so excited to put those in. And what makes me even happier and more excited for the vision of what Chief Hoskin has had and what all of our elders have is there's room for more. We're looking in other little areas, and I've been blessed to grow up in Sallisaw, Oklahoma, and just north of me, I've got a wide, diverse group of Cherokee speakers and so forth. So I've been hand in glove with them, and we're starting to identify other areas for potential in the future. But that's some of the most important things, because we know that with the loss of each elder or each individual that's a Cherokee speaker, they don't necessarily have to be an elder. We've lost some talent. We've lost culture. We've lost the heritage. We've lost those stories. And in there, we know that today, even myself, I've been talking to a group of doctors that I want to create some longevity in the life of those speakers through wellness, through getting back to the wild and getting back to our roots of how we used to eat, how we interacted with one another, and And if I can add 5 to 6 to 10 to 15 years to any speaker in that amount of time, I am very hopeful that there is nuggets of information that will be passed on, and those will continue down that line as we create those new speakers and as new speakers are born. So,
hey, Kyle,
those are some wonderful developments. Yes, Levi.
Am I coming through now? Finally,
Levi, you are loud and clear, buddy.
You can hear you.
I was watching MSNBC last night, and Brian Williams was diverted for 23 minutes. So if they can do that, I'm sorry. I apologize to our viewers, but it happened to me today, so I really apologize. So I'm happy to be here. And I want to, before we continue, I really want to thank the panelists. We put a lot into trying to assemble a group of people with a lot of talent, a lot of experience, leadership in Indian country. So from all of you, always. I just want to say that. And then, you know, Kyle, you do a really good job by yourself, but if you don't mind, I'm going to stay on.
I appreciate it.
Okay. Let me ask the next question for President Ness. And I haven't seen him yet. Okay. Hey, President Ness, thank you for coming. I know you have been working really hard. The Navajo Nation has been just hit extremely hard by this COVID-19 pandemic. And I actually admire the work that you and Vice President Weiser have done and your whole team. So I'd like to talk to you, ask a question, President Ness. What do you see as the long-term impact on the Navajo Nation as we start to turn the corner on the vaccine?
Right. Well, thank you, Levi, and thanks, Kyle, and Native News Online, and Cherokee Nation for allowing us to be part of this esteemed panel. And, you know, for the Navajo Nation, I think for the country and for the world, there is going to be some long-term impact. I think the last data that I received is that 10% of the US population, those that caught the virus, are going to have some long-term health problems. And I think it's more, maybe double, triple in Indian country. And so we have to track that as we go into 2021, into the spring, summer, fall, and years into the future. The other is the mental health. I knew that would be something that would come back and be an issue here on the Navajo Nation. So when we first, and we're coming up on our first, our 1-year anniversary of our first COVID positive case come early March. But before the first case was known here on Navajo, we developed a preparedness team, COVID-19 preparedness team, and we began to do a lot of outreach to our Navajo people and let them know, yes, this is a virus that's deadly, but as you're staying home, and I appreciate the comment about from Deputy Chief Warner about the language, culture, tradition, and the language. And we challenged our Navajo citizens because, you know, our students were at home and our parents were at home. And so rather than just be cooped up at the home, we challenged our Navajo people back then. Right around that time was growing season. So get out, get your farm, get your garden developed, get your mind off of this COVID pandemic. And, you know, this is an opportunity to teach our way of life, you know, at the house and pass down some valuable teaching. And a lot of families here on Navajo did that. But I know that the mental health impact is going to be hovering over us as we go deeper into 2021. So that's going to be some of the long-term challenges that we're going to be addressing here on the Navajo Nation. And I'm hoping that through the town hall meetings that we've had, you know, people are talking with one another at home and comforting each other, because, you know, we've lost a lot of our Navajo citizens, as you know, over 1,000, 1,152 to be precise. So a lot of people, our family members, were directly impacted, and it was different. You know, they couldn't have family gatherings, they couldn't be at the funerals, and so that's going to be around how to deal with that grief. And so appreciate our behavioral and mental health teams, IHS and federal partners, really addressing that here on the Navajo Nation to give those resources available. And we're going to do a candlelight vigil, a day of prayer for our 1-year anniversary of our first case, and to also offer resources to help the Navajo people deal with their grief or some of the emotions that they're going through right now during this whole 1 year of COVID here on the Navajo Nation.
Thank you. And I remember seeing, and I sat in the Coalition for Large Tribes meeting out in Las Vegas in conjunction with RAS last year, and Vice President Leiser was there, and he was talking with other tribal leaders about some of the preparations, and lo and behold, the following week it really hit hard, and it started hitting the Navajo Nation, and so as I said, I really do admire what you two have done, your leadership. Let me ask you a question as it relates to the current administration. Are you feeling like the Biden administration has given the adequate attention at this point to the Navajo Nation and the needs in terms of dollars and any support?
Well, let me talk more about what we're doing right now in trying to vaccinate as many people as we can. You know, with all of our advocacy, 574 tribes throughout the country, we were able to get our doses the same time the other the states received their doses, and so it's been really a change, a big change, a positive change for us with this new administration. You know, the major disaster declaration was on the desk of the former president for months, but it just took days for this new incoming president to declare a major disaster for the Navajo Nation. That brought in resources, mental health resources, as well as, you know, we having that direct access to the White House now. And as we speak, Navajo Nation has received 141,555 total doses between Moderna and Pfizer, and 120,835 have gone into the arms of our Navajo citizens. That's 85.4% of the total vaccinations that we received that have been given to our Navajo citizens. And it's because we have direct communication with the White House, as well as the, you know, acting IHS director in Washington, D.C., and plus kudos goes to our own Navajo area IHS director, Rosalind So, our executive director for Navajo Department of Health, many partners, you know, collaborating. And I think truly, I think everybody realizes it could have been a lot worse here on the Navajo Nation, but it's because of the great work of our Navajo people, honoring and respecting the scientists, the healthcare professionals, and their leaders, for listening to some of these tough decisions that were made, and some tough protocols had to be put in place, you know, mask mandates, curfews, lockdowns, but that really assisted in keeping the virus from really just taking over the nation. We truly believe in Navajo people have to be credited for an outstanding job throughout this pandemic.
Thank you. And I'm going to pause right now and before we move on with questions, but I want to thank the sponsors again. And our gold sponsor was the Cherokee Nation for today's live stream. We have two silver sponsors, Avante Optics, the Field Museum in Chicago was a silver sponsor. And then we want to thank our bronze sponsors, who are the Cherokee or Chickasaw Nation, Forest Directions, the Gun Lake Tribe based here in Michigan, and the San Manuel Tribe in California. So without this, we could not have done today's live stream. And we also I want to thank our donors who help support Native News Online through donations throughout our year. And it's very, people don't always realize you can't do these things for free. And so I say it with a smile, because I really do appreciate the support as the publisher of Native News Online. And Kyle, I'm going to, if you don't mind, I'm going to switch it back to you, and we can keep some questions coming, and we're going to switch over to talk more about the vaccinations. Thank you.
Perfect. Yes. So we're going to move on to part 2 of today's discussion, which entails vaccinations in Indian country, the actual vaccination rollout. And President Nez, I'm going to come over back to you on this one. Like you mentioned, there's been over 100,000 Navajo citizens vaccinated in your nation since the rollout. For our listeners and for people who don't know, the Navajo Nation was one of a few Native American tribes throughout the country to participate in the vaccine trials. President Nez, what do you attribute to the high rates of vaccinations in your nation? And just given that when it was announced that some tribes would be participating in the trials, I think there was a lot of pause, a lot of hesitation, perhaps even a lot of distrust when it was initially announced. Why do you think Navajo citizens have responded so well to it?
I think some of the Navajo people, those that participated in the clinical trials, looked at the bigger good of having a vaccine. I've said before, I think many of us don't question when we get our measles, mumps, and rubella shots when we're kids. And, somebody had to do clinical trials back then as well. And so when the nation had an opportunity to participate, over 200 of our Navajo residents signed up for the greater good. And of those, 80% were Navajo citizens. And with that, our town hall meetings, getting our Navajo people information so that they can make an informed decision for themselves. Remember, COVID-19 vaccinations are voluntary. It's not, we're not forcing it on our citizens. So it's up to them. And giving our public information is key. And we do continue to have town hall meetings Tuesdays and Thursdays with the Vice President of the Navajo Nation, and just give them updates, and also let them know where we're at on the vaccination. And I think that was really key. We had the Pfizer CEO, Dr. Burla, on our town hall talking about the clinical trials, as well as John Hopkins, School for American Indian Health, and many others. Dr. Fauci, Dr. Fauci was on our town hall meeting, just answering questions and letting the Navajo people know. I know when we started the 1A vaccinations, of course, that's to our healthcare professionals. So healthcare professionals know what's up with the, the reactions or scientific information, and they're willing to take the vaccination. But once we started going to 1B and 1C, then some of our elders were like, we're on the fence. But I think that's where leadership comes in. And we came in and said, okay, if we're encouraging our Navajo people to take the vaccine, then we better do it ourselves too. And we got on film and showed the Navajo people that we are willing to take the vaccine. And not just me as leader, our council leaders, as well as the Navajo area IHS leaders, took the vaccine on camera. And I think that brought public confidence to the vaccine. And now it just, it's exploded to where there's just so much interest in wanting to take the vaccine. Of course, it's not because of us or because of the information. I think it's really an individual choice, not for themselves, but for their family and for their community. That's how Indigenous people are. You know, it's not about limiting or it's not about our freedoms. It's about the greater good of our communities and our nation. And so I think because of that, many of our citizens here on Navajo have taken the vaccine.
Thank you. Deputy Principal Chief Warner, welcome and thank you for your support, the Cherokee Nation support for this live stream. A question I have for you is relating to the vaccine. Today we received a press release from the Cherokee Nation that you are entering into phase 3 of the vaccination process on the Cherokee Nation. Could you explain a little bit what the phase 3 is and how you are distributing the vaccines? Please address that, Deputy Chief Warner.
Yes, sir, gladly. Phase 3, what it entails is basically those all adults that are 16 and older who are Cherokee Nation citizens. And how we got to this is, you know, when we started out, we wanted to look at what type of vaccine allotment did we get. We take ours. We had 2 choices, IHS or from the state. We chose to go through IHS. We felt like our relationship there is solid. Admiral Watts has been a great individual to help us along with all of the team members there. And when we looked at these allotments, we started looking at places in particular, like here at Tahlequah, we have what we call CNOC, which is our outpatient health clinic. And then we have 3 Rivers, which is in Muskogee. We had Bonita, and then we had Redbird at Salisaw. Those are the sites that we started our initial. We have some denser populations in that area. We had capacity. We had the ultra temp, low temp freezers. We had those in place in those areas. And that's where we've started to do that. And along with phase 3, we went through the phases. You know, we put our elders, we put our speakers first, we put our healthcare workers first. And as we went down through the phases, that encompassed our workers that worked in our and other places like at our Cherokee Nation businesses, our Cherokee Nation entertainment, and those individuals. But we've gotten to the point now where we've got some areas that have been a somewhat of an area of concern where we don't want to waste vaccine. And we were just, Chief and I went this week to visit our pharmacy and some of our areas where we're keeping our vaccines here locally in Tahlequah, and got the rundown on how the Pfizer, how they ship it, and how the individuals have to, you know, press a button and then this goes back to Pfizer and they report back. And you know, we had a shipment that came in that, you know, something may or may not have happened. So there was a moment where we waited to see before we could administer this dose and so forth. So the intricate details, I like those details. That way it helps me tell the story more broadly. But we felt like we've moved into a phase we don't, we try to fill all the appointments that we can. And we're now to that phase where we felt like it's efficient enough that we open it up to those individuals. And as I said before, we've administered 24,000 doses of vaccine, whether it be Moderna or Pfizer. And yesterday we were visiting some of our COVID-19 CARES Act projects, and one of those is in Stillwell in Adair County, where we've got a lot of Cherokees that work for us. We have over 11,000 employees across the government and the business. So we built some new office space that kind of spread some people out and one-stop shop. But down in one particular area, we had a building that we built in, and for the last 3 days, they have been doing vaccines through there, because at Stillwell and at that clinic, it is under major construction right now, which was, it's a great thing, but during a pandemic, it's not the greatest thing to be under major construction. So we had some area, but we were strategic enough and able to open up this kind of alternate site, and we have a drive-through. So it's been good. Yesterday, I know they vaccinated, and kind of when we start out, we want to learn how to crawl, then to walk, then to run. So to speak. So that's kind of put us where we're at today. We are, we walked through the clinic here in Tahlequah, and the way that it's set up and the thought that went into everything has played a great role in how that we were able to get these vaccines out efficiently. I think the next step for us, as President Nez was stating, is all the public health messaging that they've done. I think that's key. And in our area, I think that's something that we could work on even closely. We've had great communication, but I think we need to do more in each of our respective areas. There's always different types of hurdles and obstacles that you go to based on how the communities are built and what's the demographic look like in those areas and so forth. So taking all of that into consideration, you know, when we look at vaccinating over 50% of our speakers already, hitting close to 50% of our employees and so forth. And like President Ness said, it's a voluntary thing. It's an act of love. And Chief always says it best. We always ruled and thought on the side of science and compassion. And when we stay in that lane that the Creator provide us, that falls where science and compassion meet, I don't think we can lose in this battle if we keep moving forward and learn from one another. I mean, I very much appreciate the comments that have already been made, but that's where we're at today, and we're looking forward to. We've got some questions out to IHS on moving forward with our vaccinations, because as many people know, we have a lot of intermarried families where you have whether it be other natives can come to our IHS facilities, but what do you do for non-beneficiaries and things like that? Because the level of the closeness that we live in our communities, and especially here in Northeast Oklahoma, it's important that we look to the greater good and we all continue to work together. And I always, in Oklahoma, we have a place called Brahms, and they serve ice cream. They're a family-owned business that grew up here, and I always feel like the Cherokee Nation taking their distribution from IHS, not taking anything from the state, it give Northeast Oklahoma a chance to get a double dip, if you will, and make that, broaden that horizon and try to help for the greater good.
Thank you. I want to just real quick, I want to follow up on that. So just so our viewers understand, your receipt of vaccinations has come through the Indian Health Service thus far. It's completely separate from the state of Oklahoma.
Yes, sir. It is. Yes. Very, very much separate. Yes, sir.
Okay. Thank you very much. Kyle.
Dr. McCabe, I'm going to circle back to you. Thank you again for being with us today. I was just wondering if you could talk a little bit about vaccine hesitancy and how you think leaders in Indian country can overcome it. Because I think even to this day, despite some of the successes we've talked about so far about the delivery of vaccines in Indian country, there's still been some hesitation when it comes to taking it.
Sure, absolutely. And that is true, Kyle. Vaccine hesitancy in general is impacted, as we know now, for the general population of the United States. But as we know also, it's very true for our tribal communities and tribal nations. It's impacted by an individual's and a community's knowledge of current and past experiences. That's where hesitancy can come from. The history of our tribal nations, the racism, the politics and policies from the United States government, socio-demographic factors, all of these can impact this hesitancy. And those are just to name a few. Hesitancy is also influenced by the media, by communication. How do we communicate and how much do we communicate to our peoples? The role of public health and vaccine policies, how robust are those in our communities? There appears to be a spectrum of beliefs and behaviors when it comes to vaccine acceptance. This is a spectrum. So on one end of the spectrum, there are those who just have vaccine refusal. They refuse to take these. In the middle of that spectrum is the vaccine hesitancy group. On the other end of the spectrum is the vaccine acceptance. So it's a continuum. And remember, these individuals can move from one group to another. This is not static, this is dynamic. And this is why a major force here might be education. Providing education on the COVID-19 vaccines themselves. And I'll get to that in just a little bit, but I'm not going to say too much about that, otherwise I'm going to use them all the time here. The World Health Organization in 2019 declared vaccine hesitancy as one of the top 10 health threats. So this is not an insignificant factor in attempting to control particularly this pandemic, but also any other infectious disease that is out there. So what is at the root of vaccine hesitancy? I loved it when I heard one of our native grandmas, our native elders, say when her community was impacted by unethical behavior in research, she said, science is not the problem. It's the scientists. And that is so true. There can be so much unethical activities that go on by the researchers. When she said scientists, by the researchers. So I just love that quote because we natives, we have our cultures that have documented references on how effective our tribal nation cultural wisdom is in preserving, and there's evidence of science from our tribal nations. There's evidence of that there. So we're not immune just to the science. We know science. We did it in a different way. So we have our knowledge of this than what Western society has, but our ways work. And I really want to make that point. American Indians, Alaska Natives have mistrust in and fear of some of the activities and recommendations of the federal government. And as I mentioned, this is based on history. So mistrust, fear, historical trauma, all of these are the results of the lies, the lack of transparency, the misinformation, the lack of honesty, and the unethical behavior on the part of the United States government. So our history is long there. We have lived through this, but remember, we have come through it too. That's another critical point. We had the broken treaties, which led to the loss of our land. We had research, as I mentioned, the unethical behavior. In clinical care, we had the forced sterilizations of our women, Native women, by the Indian Health Service in the early 1970s. And there are so many other examples I can give about the clinical care and the lack of, because of some of the activities of our providers. Not all of them. We have good people out there. I have to say that. We have good people out there in all these arenas, but we have been impacted by those that have not been so upfront and ethical about things. In our educational system, there's racism. We have unequal access to quality education. In the governmental policies, these actually, United States governmental policies were actually directly intended to deculturate and assimilate us into the majority society. That's what those policies were all about. If you really look at the bottom line on those, they couched it in different terms, like these are going to be good for you, Native peoples. But when you looked at it, there really was an underlying issue to that. We look at the boarding schools, and I went to a boarding school. I attended a boarding school, so I know what that was like. The Dawes Act in 1887, the Indian Removal Act in 1830, and then the establishment, of course, of reservations in 1851. And these are just to name a few of those policies that have impacted us negatively. And we remember these. We remember these. Now, let's look at the common themes for strategies. There's a whole bunch out there, but there's one that I do want to focus on for this particular presentation. And before I go on, I just want to say there's very little data on this, especially in American Indian and Alaska Native communities, very little data. There's no magic solution on how to address vaccine hesitancy. And many of our tribal nations have already been addressing these things, as we heard from both of our representatives here from our tribal nations. They have been addressing this. But the point is, again, I want to make is there's no one size fits all. I love the quote also by getting to the point of no one size fits all. One of our women elders said, when you see one tribe, you have seen one tribe, meaning you cannot extrapolate what you have seen in one tribal nation to another tribal nation. And within that tribal nation, there are differences among communities. So we have to be, as tribal leaders, as tribal representatives, as tribal educators, we have to be very, very aware of the differences even within a tribal nation. So this report is what I want to focus on. The Urban Indian Health Institute, which is a branch of, or a division of the Seattle Indian Health Board, produced a report. It's called Strengthening Vaccine Efforts in Indian Country. This came out January 28 of this year. And the goal was to inform on program development related to vaccine efforts in urban and rural American Indian and Alaska Native communities. I'm not going to go into the details on what they found specifically, the percentages, et cetera, but I am going to go to the strategies, what they wanted to, what they thought would be effective. And some of these have already been mentioned by both the representatives from our tribal nations here today. Cultural values were critical for those who were willing to take the vaccine. They wanted to do this because they felt it was their American Indian, Alaska Native community responsibility. They had a responsibility to the community to do this. They also believed strongly in that this way was a way of preserving American Indian and Alaska Native traditions. They also had this cultural pride that they had, and also included the love for family and the respect for our tribal communities. Our elders were brought into this. And the other thing they mentioned were future generations. We're not doing it for just us right now. We're doing it for future generations. The other recommendation or the other result that came out of the survey was that they noted trust in tribal and urban Indian health clinics. That's where they felt they could really get good information from on COVID-19. They also had trust in their healthcare providers and in the elders, which in many cases is synonymous with tribal leaders. And tribal leaders were also mentioned as a group that they trusted. So these groups here are as I think President Nez mentioned, they trust the tribal leaders and they listen to what the tribal leaders are saying. So again, this came out in this report. Another recommendation was to provide clear, comprehensible, that was very, very, that came out loud and clear, comprehensible information on all aspects of vaccine development, safety, effectiveness, side effects, cost, community benefits, et cetera, et cetera. That's what these individuals who were willing to take the vaccine wanted to know about. And also those who were unwilling, by the way. They wanted those who are involved in this to acknowledge the history of the development of mistrust and the ongoing activities that enhance this mistrust. That has to be acknowledged. I have heard many, many times throughout my careers when I start talking about issues like this, I will have the white professionals, white scientists say to me, Melvina, just get over it. I mean, they would not even tell their own communities to do that. That is just an absolutely ridiculous recommendation. Utilize the resources that have been developed by the community is another recommendation. Inform on vaccine hesitancy, and that's what this webinar today is doing. So this is exactly what this webinar is doing. So this is wonderful. I was so happy to see this too. And also that community-based efforts are critically important. You have to involve the community. They must have a voice. I have so many other recommendations, but I'm not going to go into it. So I'm going to.
Thank you, Doctor. Thank you, Doctor. Thank you. And we're going to wrap this up. We have about 5 minutes left, and so we're going to move it along. Stacy, are you still with us? I have a question. What on a national basis, what are you hearing about hesitancy among Native Americans for the vaccine? So, Stacy.
Yes, sir. I'm hearing, it tracks with what is being said here. The effort now is really about public health education, and the points that Dr. McCabe made, that President Nez made, that Brian Warner made, they're all consistent. And, we may be dealing with 574 different tribes, but we're dealing with human beings also who need basic information and to be treated with basic dignities and respect to understand the vaccine, understand the opportunity, understand what happens when you don't take the vaccine, and really have folks be able to make their own decisions. We've worked very hard at NIHB to make sure that there is and will continue to be a healthy supply of the vaccine to American Indian, Alaska Native people. And largely, I mean, because of the way this virus has hit our people, that request is met with a lot of affirmation on Capitol Hill. I just also want to say, we have to remember that, you know, we have our people all over this country. I am from Sault Ste. Marie. My tribe is in Sault Ste. Marie, Michigan. We have 44,000 members, but here I am in Washington, D.C., caring for giving the best service I can to not only my tribe, but all tribes. I can't get the vaccine, and I'm a cancer survivor, and I have type 2 diabetes. So I think we need to also be sensitive to our people there are 4,000 of us here in the DC metropolitan area. And were we not here to serve our tribes, we would be back home getting the vaccine. So it's just something to think about. And it's all of us, you know?
We appreciate those comments. That's pretty significant. And
Stacy, can I ask one follow-up just to maybe enlighten some people who might have a misconception about what happens after you get vaccinated? Should people stop wearing masks and go about business as usual after being vaccinated, or
first of all,
should we keep going about?
Absolutely not. Absolutely not. However, I think we have a doctor here. I would prefer to have the doctor answer the question because I think the answer will mean more coming from Dr. McCabe.
Dr. McCabe.
I'll try to make this really fast. I know time is short here, but what Stacy said is absolutely not. We need to keep all protection measures going, not only wearing masks, but washing hands, physical distancing, avoiding large crowds, paying attention to indoor areas, outdoor areas, and in indoor areas, make sure we have really, really good ventilation. And there's so many reasons for this. So if you look at the Pfizer and the Moderna rates for efficacy, it's 95 and 94% respectively. There still is that 5% risk there of getting the infection. So we need to be, no vaccine is 100%, by the way. So my own opinion on this is I think from here on out, we're going to be following these protection measures. Yeah. We have to. We have seen the rates of flu drop, and we think for this season, and we think it might be because we are following these measures. The other thing that is important here is to keep these measures going is we're not clear whether we can transmit the virus after vaccination. We don't know that for sure. We still might be, those of us who are vaccinated still might have the virus in us, but we have no symptoms. So that's a person who can still transmit. And that wasn't looked at in the clinical trials. A third reason is the mutants. We now have the United Kingdom, South Africa, and Brazilian mutants or variants within this country. And California, we have identified a new California variant. That the scientists are worried about because some of their findings seem to be a little bit more worrisome than the other existing three. So, absolutely, we do need to maintain and continue our protection measures. We do have 2 more vaccines coming up. I believe it's the Johnson & Johnson vaccine is going up for FDA approval tomorrow. They're going to be not the approval to be given, but the evaluation of the results to be looked at. And the other one is the AstraZeneca vaccine. And that one looks like it's going to go up for FDA consideration in April. So we do have those vaccines coming up. So again, we need information to our people about those 2 vaccines. What were the vectors? Are they mRNA vectors? They're not, but that's the kind of information that has to get out to our people so they know what they're getting in their vaccines.
Kyle, do you have some final words before we close this down? Did we lose Kyle?
He's on mute.
Let me say this. Kyle, you there?
I'm here. I was muted. I apologize.
I'm sorry. You have some final comments, and we'll close this down.
No, just thank you so much to everyone here for taking the time and for educating Levi and I about some very important issues in Indian country, and for all our listeners that are on our Facebook page watching this. Thank you, Chimagwech.
Yes, and I, as the publisher of Native News Online, I want to again thank our sponsors, our panelists, our viewers, our readers to Native News Online. It's just a very, very powerful thing that has happened to Indian country. We want to do our part, and we will continue. We are committed to keep reporting on COVID-19. And thank you very much, and have a great rest of your day. Thank you.
Thank you, everyone.